I Hate the News is the weekly news bulletin from I Hate Politics podcast, a show about a human activity we love to hate. I'm Sunil Dasgupta. It's January 20th, 2026. Maryland's new House of Delegates Speaker, Jocelyn Peña-Melnyk, has been on a press tour, and she joined us to talk about the new era and its challenges. Among the issues the new speaker knows all too well is Maryland's emergency room wait time problem, second to last in the entire country. Former ER doctor and former legislator Dan Morheim, who sits on the state task force, says that 16 months after the task force was created, we still don't know why Maryland lags in this regard. Responding to heightened fear of ICE action in Democratic jurisdictions, Montgomery County Council is looking to turn a 2019 executive order protecting immigrants into law. Council President Natalie Fanny Gonzalez joins us to explain. Also in the county, the Maine County Government Employees Union, McGeo, has filed grievance to get the county government to provide police protection to employees in dangerous situations. And more. Stay with us.
You're still on to me when I'm alone, and then I start to feel it creeping up inside. I told myself that this was the last time. I think I'm losing my mind.
I Hate Politics is a podcast about our neighborhoods, workplaces, schools and streets, and our local governments as they function in diverse and democratic societies. This means our politics are messy, dirty, sometimes corrupt, with often self-serving politicians. But no matter how much we may hate politics, we are never exempt from it, even when we refuse to participate. In fact, the purpose of politics is to keep society functioning precisely when we don't agree with each other, like now. Music for this episode comes from Montgomery County native and now DC-based singer-songwriter Kara Levchenko's two new single releases, Animal and Cosmic Love. You can find her and her music at karalevchenko.com.
The way I'm wrapped around your finger feels so criminal. I sense you clearing from a distance, it's disturbing. No, make me a target like an animal. You're so suffocating, let me go. Oh, wow. The way I'm wrapped around your fingers feels so criminal. I sense you clearing from a distance, it's disturbing. No, make me a target like an animal.
Jocelyn Peña-Melnyk, welcome to I Hate Politics.
Thank you for having me. I'm excited.
Congratulations on being Speaker in the House of Delegates in Maryland. You are the first statewide Latino official. How much pressure do you carry for that?
For me to be in this position, it's a really, really heavy responsibility because I don't want to be the last.
You have been on something of a press tour, causing you to also become a little bit sick as a consequence. And you have said you may not have all the solutions to problems right ahead, but you're ready to work. Your members are ready to work. What questions are you looking to answer?
The biggest challenge we face is, the budget. This year, it's made more difficult because we have a projected $1.4 billion deficit, which, largely have been driven by the federal government, the impacts on the federal government, and we're so close to DC. But I want to focus us on the affordability issues. Sunil, the house that my husband and I purchased in 2001, we couldn't purchase today. And I worry about my kids being able to purchase a home. My girl who lives in Baltimore City and rents a home, she goes to school there, her energy bill is over $300 and she keeps her thermostat at 60 degrees. I have people that are not able to have access to healthcare as well. So you're going to see a lot of the bills this session are going to be on housing, energy, healthcare. We have to react. And is it going to be easy? Absolutely not. It isn't. I'm not I used to be a dreamer when I came here 20 years ago. Not anymore. I'm more pragmatic now.
You asked the Senate president for a joint budget committee with you and him and the key leaders from both chambers. Are you going to get that joint committee?
Yes, we are. And we're going to start meeting. We have a meeting this week
Seems that the Senate and the House have an ideological difference.
I would disagree because I know that Chair Barnes, who chairs the Committee on Appropriations, and Chair Guy Gazzoni, who chairs the Budget and Tax Committee in the Senate, have a good relationship. And we have not, had a lot of struggles at all. Like, we're able to come to a meeting of the mind. And it's because they have a relationship. They meet and talk early. And when we do get stuck, we put together a small committee to work it out.
The Senate in 2024 passed Senate Bill 1. BG&E has increased its rate significantly as a consequence of SB 1. And you have now introduced House Bill 1, which is trying to roll some of that back. Where is that reconciliation?
A lot of people read Senate Bill 1 that way. I would disagree, but we're going to leave it there. The bill helped people, and we are doing more to give relief. We did a veto override when I had the special session in December for the data centers. We don't want to pay for the other states around us. You're going to see bills on battery storage, on net metering as well. I put together a group that is being led by someone that you know, Delegate Fracio Hidalgo, who's my brother from another mother, who is really amazing and very smart. And I actually asked him to bring Senator Feldman, who the energy bills go to his committee, and for us to start meeting this week. I have told my chair, Sunil, to be bold. I moved the energy subcommittee and I placed it in the environmental and transportation committee, which is actually chaired by Chairman Corman, who you know well. And I transferred that subject matter to that committee because I believe that you have to have the discussion of energy, but also the environment. They go together, and affordability, which is so important. It took me, honestly, more than 50 hours to make those decisions, where I will wake up in my pajamas, keep working, go to bed, wake up again. And I can show you the pictures in my dining room. On the walls, I had all these posters with masking tape in all the committees. And I had all these little notes, right? And I would, different colors, and I would move it here, sleep on it, wake up again. I've been there 20 years. And in 20 years, you start thinking and you go, well, if I was ever in charge, what would I do? What would I change? And I figure that while I have a honeymoon period, and I hope and pray to God I keep it for a long time, I might as well make the changes, right?
What other synergies are you trying to gain?
So look, there are a lot of delegates that are younger than me, that have young children. Mine are already in their 20s, thank God. They have young kids, and this is supposed to be a part-time job, and it isn't.
So you're saying you distributed the load a little bit better?
I did. I lowered the number. Like, most committees had 24 members. Now they're 19, 18. And the one that has the most, of course, it's appropriations. But that's because it should have representation from a lot of these districts, right? And they do the budget and some policy, but not as much policy as the other committees. These committees, Sunil, had not been changed in over 25 years.
The new Government Operations Committee and the Health Committee, they have serious challenges ahead. The unemployment overpayments are a big issue. And on the health side, the coming end of all-payer system is going to be really significant problem to manage.
The person on the Health Committee who chairs the Committee on Government Operations is Delegate Ken Kerr from Frederick.
Right.
And I asked him, and everybody loves health and government, maybe because I share it, just kidding you. But in any event, I asked him, can he transfer to the new committee with that subcommittee? Every person that I chose to lead these committees or to lead a subcommittee are people that have expertise. For example, personnel was in appropriations. And I asked Jared Solomon, who is actually from Montgomery County, another amazing human being, very conscientious, to transfer to the new committee and to leave appropriations.
With the all-payer system, where do you think a solution even lies?
So look, you had Vice Chair Collison, and you had John Crone from the HSCRC, which I made arrangements. They said it. They told you what they thought, and I'm going to leave it there.
Have you thought of what happens to the HSCRC? They need a new role now. They were doing this negotiations with the hospitals. Now they can't do it for Medicare. So what did
The federal government does not want us to set the rates for Medicare because they said it violates free market, which now if you look at all the other states that are struggling big time, we are safe, thank God, because we have the old payer system and it works. So basically, they still have to oversee Medicaid, which we have 1.5 million people on Medicaid in Maryland. 1.5 million. Our population is 6.3 million, and they have to manage the private carriers as well.
will the hospitals remain within the system if once Medicare just is negotiated separately?
We don't know, right? I mean, the dates for that, thank God, are in 2028.
Have you thought substantively about the ER wait times problem? Because that seems to be a problem. As I looked at the interim report, and the interim report just restated the problem without even explaining why is it that ER wait times are the second worst for the entire country in Maryland.
Look, we passed a bill. They created a commission to look at that, and they're doing their work, and they're going to come up in the next months or so with recommendations. And what I know is that I have personally spoken with the HSCRC and with the Department of Health and have requested some legislative relief for this session. Okay, there are a number of factors why this is more complicated. Our hospitals are bigger and more complex. For example, we had a lot of academic medical centers in Maryland. There are severe throughout challenges, especially with discharges to post-acute settings. We have pediatric overstates, which is a problem. ER borders as well, which we've been dealing with legislatively. We have a problem with access to primary care. If you have an adequate primary care workforce, and you have people that are able to have a doctor and go to their doctor, it prevents patients from going to the hospital.
Let's talk a little bit about housing. Again, a big affordability issue. Yeah. The problem is that very typically counties have opposed a state-mandated solution to the problem. Even if they agree with the solution, they just don't want it coming from the state. They want it themselves to do that because they want to take credit for it.
Well, I don't know if it's because they want to take credit, but we're going to do something about it this session.
Do you think conceptually the state should set some parameters across the entire land?
I don't know that I will go as far as saying that, because I think that the county should have a say in zoning, right? And people should have a say as well. My neighbors should have a say in it as well. But housing, it's a human right issue, Sunil. I'm a municipal person. I used to be on the city council in College Park. I have two municipalities in my district, College Park and the city of Laurel. So I'm not going to do that to them or to anyone else. But I hope that we can come together to find some solutions, because we are in a crisis. I get the calls in my office of people that cannot pay their mortgage. I get the calls in my office of people that cannot pay their rent and have to go to court, and I have to help them find a lawyer to go to court with them.
A third of the state has already got rent control. Do you think the rest of the state needs rent control?
It is a tool in the toolbox, and I know I have supported it in the past. Like any tool, you have to know how to use it. And I think that it's a discussion, just like affordable housing and everything else, that would, be discussed in the future, and people will bring it up.
Don't you think in order to balance the budget, you will not be able to do, for instance, pick up the slack on SNAP or Medicaid or provide more money for housing?
We are making sure people have SNAP, and feeding people and healthcare are very important. Are other agencies and going to be cut and other things? Yeah, there's no way we could do it without it. What's going to be cut? Don't ask me that, because I haven't even seen the budget.
I imagine that there is some kind of consultation between the governor's office, between your office and the Senate president's office, even before a budget is really crafted.
Not everything. We talk about it generally, right? But we don't see it until it's proposed. We do discuss some of it, but not all at all, because we don't know yet how we're going to, how we're going to balance it. We know we're going to, and it will get done because we do every year, but we don't know yet how that's going to happen. And we're waiting for the governor to make his proposal. I know that he put money into public safety, which was important. He put money into K-12 education, which is important. We heard that and saw that as well. So, and we have been in touch with his staff. I have, and his budget secretary. Jake Weissman is an amazing human being. I know him before he came here. Good people. And he has been very, very, nice and has reached out. But, we'll keep talking.
Speaker Jocelyn Peña-Melnyk, thank you for taking the time. I hope you feel better.
Thank you, Sunil.
That was Maryland House of Delegates new Speaker Jocelyn Peña-Melnyk. If you are trying to draw a power map of the newly organized chamber, I hope you paid attention to her who's who. You're listening to I Hate Politics. I'm Sunil Dasgupta. I'll be back with more voices and more stories in this episode. Maryland ranks second to last in the entire country on emergency room wait times. The state set up a task force to study the problem in the summer of 2024. Dan Morheim is a former ER doctor and former state legislator who is a member of the task force.
Probably 60-70% of the patients I saw could have or should have had their problem taken care of in some other way, generally through a preventive measure. There's just not that much spontaneous illness and injury out there. Within the hospital operations, there simply is not enough staffing.
None of this is unique about Maryland, but Maryland has the worst number. Why is Virginia better and Maryland not?
Some of this is said to do with how hospitals are financed. The all-payer system has its advantages because it means that hospitals don't transfer patients because of fiscal status. But it's created a set of incentives, however that mechanism works, that does not encourage hospitals to become operationally fluid. And
why not?
I think it has to do with they're trying to shorten length, they're managing their length of stay.
If you shorten the length of stay, ER wait time should reduce.
It should, but that's part of it. The other part is a lot of the incentives are things that are not related to ERs, developing high-end surgical procedures, which are fine.
Johns Hopkins does high-end surgical procedure.
Mm-hmm.
The hospital in Allegheny County is not doing the same things as Johns Hopkins, even though they may be competent. I'm not imputing anything. Are ER times worse if you are doing these kinds of high-end medical procedure versus places that are more general hospitals?
It works badly in both places. There are long ER wait times, as you're pointing out across. And
Why?
I don't have a quick answer. And I was hoping and am hoping that that's something that the commission will dig into in depth.
It seems so weird to me.
It does seem weird.
That such a central problem doesn't even have significant hypotheses.
ERs are also the source of most hospital admissions. You look between usually 50, 60, 70, 80% of hospital admissions originate in the ER. I'm also at a loss as to why this is the case. My experience is based on my clinical sense, and I champion clinical corrections because I know those will work. But the system, the HSCRC and the Maryland Healthcare Commission have not tackled this head on. The legislature has been acting as best as it can, and we have fallen short in terms of being able to answer the very pertinent questions you were asking.
So we don't know right now. We don't know why Maryland's ER wait times are the second worst in the entire country.
Yes, you're right. We don't know. And that was the reason for the ER Wait Time Commission. 15 months, 16 months later, since it was formed, all we've accomplished so far is a restatement of the problem.
Dan Morheim, thank you.
Thank you.
With ICE activity intense in Democratic-controlled jurisdictions, Montgomery County Council is looking to codify a 2019 executive order from County Executive Mark Elrich into law. Council President Natalie Fanny Gonzalez explains.
Basically, what we're doing is putting into law the practice that we have in Montgomery County of ensuring that our police officers are not acting as immigration agents with the federal government, and that every single person in this county, regardless of their immigration status, can access or resources in the county, that no one from the county can be asking somebody if they're a citizen, if they are a green card holder, if they're a DACA recipient, and so on. Putting that into law. Now, you may ask, Natalie, why is this important? Let me just tell you, the fear that the community feels right now is huge. I don't think I can put into words the number of conversations that I have had with students as young as kids in elementary school, with moms and dads, with the elderly, people who have been in this country for many decades. The fear that they have that they could all of a sudden be separated from their family. And that fear is attached to this hesitation of not calling 911 when they feel that there's something is wrong in their community or that there is a crime happening. We cannot have neighbors in our county having this fear of asking for help when they need it the most. So by putting into law that Montgomery County will not use its police force as immigration agents, and that you should not fear, going to a senior center to obtain a warm meal, or that you shouldn't be going to a food hub to get assistance for food, or using our mobile vans for access to healthcare. You should not have that fear. And for me, the way to ensure that the community can feel that they have trust in the government, or at least more, is by telling them this is not just a practice, this is the law in Montgomery County.
You talked about law enforcement and what county police can and cannot do with respect to immigration, serve as immigration agents, you called it. Now, it doesn't cover the threat that ICE is presenting when that happens. So say ICE, comes into somebody's home. At that point, there is no protection that can be offered within the Trust Act to those families. So this is just for when normal things are going on.
And our involvement with the police. And that is, it may sound simple, but right now we have data showing that the police department are receiving less calls from certain neighborhoods because they have this fear of calling our local police. The point is to ensure that because of public safety, because we want everybody to feel that they're okay in Montgomery County, putting immigration on the side.
But so in these areas, is crime also increasing as a result?
I don't. That's hard to tell. I mean, crime is
so there are fewer calls, but
yeah.
But as a consequence, is crime increasing? So if crime was increasing, this would be more urgent. If crime is not increasing, fewer calls means that there's less.
Yeah, crime. No, but what we're hearing, especially with the police department, is that when there is a crime, any crime that you can think of, and they're investigating the crime, they're having a hard time getting people to participate in giving them information in case they saw something or heard something. That collaboration has decreased significantly.
There is a part of the bill that looks at physical access to county buildings.
Yeah. I love that physical access, especially to places like the public libraries. They're known as the sensitive locations, and they're part of the bills, as you mentioned. Basically says the coordination with immigration enforcement official is restricted in sensitive locations. And just giving the example as library, an agent or department must deny access to any portion of a sensitive location that is not accessible to the general public to any individual who's seeking access for the purpose of enforcing federal immigration law, unless they have a judicial warrant.
So ICE agents come to a public library. What can the librarian even do at that point? But they are there armed. What can they do?
As part of the processes that we have, and this also applies with MCPS, if an immigration agent arrives to a public building, including the schools has to deny access and contact our attorneys right away.
Well, so what do you mean deny? I really don't understand. So
not to let them in.
How do you not let in armed folks that are willing to break down doors? What is a librarian or a school principal or a school secretary supposed to do if 10 ICE agents armed to the teeth, masked, arrives at your door? You're going to say, no, I'm not letting you in?
You're going to say, no, we're not letting you in unless you have a judicial warrant, and then contact the attorney right away. Yes, I understand what you're trying to say.
They're in physical danger at that point.
I know, but regardless of maybe or not, they're going to be in physical danger. Yeah, and that's the reality of the U.S. right now. We have an agency that is, I see them as paramilitary right now. They're going rogue, and they're doing illegal acts right now, and they're killing community members just because they're confronting them. It has happened in Maryland. Happening in Anne Arundel County, and it's happening in many places across the nation. So
the Trust Act does not address those kinds of extreme situations if there's an assault.
Because they're reckless, and some of them are even illegal. But the Trust Act is basically based on things that we as a county are able to control. I am able to control that our employees cannot ask anybody for their immigration status if somebody's looking for food. And I can ask, putting into law that the local enforcement of Montgomery County cannot act as immigration agents. That's something that I can control. Everything else, sadly, is out of my hands.
Natalie Fanny Gonzalez, thank you very much.
Thank you for having me.
It's in your nature, baby, should've known. I thought I loved you, but I didn't know how. Think you've been lying to me all this time. Thought I could catch you in the crowd.
Late last year, a crisis management team from the Montgomery County Department of Health and Human Services was attacked by a patient. Ryan Conlon from McGeo, the main county government employees union, picks up that story.
On December 15, 2025, at around 11 p.m., two of our members were responding to a mobile crisis outreach team request in the Rockville area due to a family member that was having concerns about the behavior of another family member, which would be the client in this case. What happened was when the workers arrived at the scene of the incident, they called the family member who had initiated the call to the crisis center initially for a status update. That family member indicated that the client had gone outside, and then shortly after making that statement, the client had appeared and quickly approached the vehicle that our members were in. The client then began to kick that vehicle, punch at its windows, and threatened that they would kill both of those employees. Once this had occurred, the worker in particular that was driving the vehicle pulled away to a safe distance and then proceeded to call 911. As this worker was giving the report of what was occurring to 911, the client was observed going through the neighbor's trash, knocking items over, and pulling out several blunt items and objects, with which the client then struck another vehicle at the scene with. Shortly after that, the client jumped on the hood of the vehicle that the members were in and caved it in. And then after jumping on the vehicle, that client disappeared. And the outreach team then went to the front of the home where they found the client's mother, who was observed screaming for help in the driveway with blood coming from her hands and her forehead. The worker that was driving the vehicle then rushed up to the driveway to try and assist the mother, get her in the vehicle. However, that client emerged once again and was carrying what appeared to be a bread knife. The client then proceeded to charge at the mother as the employees were attempting to get her into the crisis center vehicle and drag her to the ground while swinging that knife and striking her repeatedly. The worker that was driving the vehicle then sped back up the driveway while they were honking their horn and flashing their lights, which was an effort to draw attention from neighbors, other folks, to distract that client away from the mother. The client at that time filed the vehicle down the driveway and stated to the employees, "Do you want to be next?" and then returned to the mother, where the client continued to cut and stab at her with that knife. Shortly after this occurred, the police had arrived, and the client was ultimately subdued by the police.
Health and Human Service members who are there are part of the mobile crisis teams?
That's correct. They were dispatched as a part of the mobile crisis outreach team.
What was wrong in the way the dispatch happened?
This is a situation where clearly there should have been a simultaneous law enforcement dispatch automatically to this particular incident. And that's, with the grievance that we have filed, what we want to ensure and mandate moving forward that is already an automatic.
Is there any real way to know that a crisis management call like this would go south? I mean, prior to it happening, so that you are able to staff it correctly with police and crisis management people? Or is it the case that, we don't often know what's going to happen, and sometimes it'll happen correctly and sometimes it won't?
I think, Sunil, to that second point, I think that's what it is. I think you don't necessarily know how something is going to escalate. And that's really why it's important that what we're asking for is that there is that presence if needed. And, if there isn't, then okay.
Do you have a sense that the police can, in fact, do it and they won't be stretched by this?
I mean, I don't know, I don't know in particular. I'm sure, of course, that would be, that potentially could be an issue. Absolutely. But at the same time, we need to ensure that we don't have an occurrence like this again.
What is the next steps on the actual grievance complaint? What happens next?
From the filing date, the county now has 30 days to provide a written response to the grievance, either accepting or denying. Additionally, within this 30-day window, a third-party mediator neutral will hear this grievance, with us presenting, county responding, and then ultimately will come up with a advisory opinion. If at that second step we don't settle the matter, the county then would have 45 days to provide a decision, a final written decision, basically the final disposition from the county as to whether or not they would accept or deny the grievance. And then within 45 days from receiving that decision, we could invoke binding arbitration. But I think our larger hope is that this grievance will get the county's attention, and that, we will come together and be able to resolve this.
Ryan Collin, thank you.
Thank you, Sunil.
I don't care if silence playing games today, but it ain't fair. The thought of you takes me away. Now I need air. Yeah, I think I got lost in my head again.
That's all for this episode. Be sure to check out our feature interview series that comes out Friday mornings. I Hate Politics is produced by me, Sunil Dasgupta. Music for this episode comes from Montgomery County native and now DC-based singer-songwriter Kara Levchenko's 2 new single releases, Animal and Cosmic Love. You can find her and her music at karalevchenko.com. If you want to share your music on the show or know someone else who might want to, please email us at producer@ihppod.org. I hope you will subscribe and share the podcast as we bring you stories about politics close to you and to your home. See you next time.